All right, future RNs, welcome. Listen, you have put in the work, you've survived those crazy late nights, and now it's time to tackle that one last thing. So in this explainer, we are going to break down everything, and I mean everything, you need to know to walk into that NCLEX with total confidence and walk out with your license. And you know what? That is the absolute truth. Think about it. You have made it through the marathon that is nursing school, and we both know that's a journey not everyone gets to finish. So this exam, it's not just another test. No way. This is the finish line. So let's kind of reframe how we think about this. This isn't just an exam, okay? Let's think of it as the final quest in your hero's journey. You spent years gathering all the knowledge and skills, and now it's just time to prove what you can do. I mean, every single exam you stressed over, every late night you spent with a textbook, every single time you practiced sterile technique until it was just second nature, all of it, every little bit was preparation for this exact moment. Your program has been training you for this from day one. Okay, so let's get into the nitty-gritty and decode the test itself. Because, look, to beat the NCLEX, you first have to understand how it actually works, because it's not like any other test you've ever taken before. So this is where it gets really interesting. The NCLEX is literally built around you. It's what's called a computer adaptive test, or CAT for short. And what that means is it's not about getting, say, 80% right. Nope. It's all about proving that you can consistently answer questions that are above a certain difficulty level. And that's the official passing standard. All right, now this part might sound a little scary at first, but it's actually a hidden advantage, I promise. The test forces you to trust your knowledge and just go with your gut. You make a decision, you commit to it, and you move on. No more falling into that awful trap of second-guessing and changing a right answer to a wrong one. So what you're looking at here, this is basically the heart of the exam. The vast majority of the questions, we're talking over 80% combined, fall into just two big categories: physiological integrity and safe and effective care environment. This is a huge clue. It tells you exactly where you should be focusing the bulk of your study time. All right, so on your quest, you're going to face a bunch of different challenges. See, the NCLEX isn't just a simple multiple choice test anymore. Knowing what these questions look and feel like beforehand is a huge advantage. It gets rid of any surprises and lets you just focus on the content. You know, the exam itself is evolving. It's shifting away from just asking, what do you know, to really digging into, how do you think? These next-generation questions, or NGN, are designed to test your clinical judgment in situations that are a lot like real life. So you're going to face everything from drag-and-drop questions where you have to prioritize nursing actions to these hotspots where you'll literally click on a part of an X-ray that looks off. You'll even get these complex case studies that unfold over several questions. The absolute key here is to practice these formats so that nothing feels new or weird on test day. Okay, now for the fun part. We've decoded the exam, we know what the questions are going to look like, so let's get you equipped with the essential tools you're going to need in your toolkit to absolutely nail it. This is so important. Before you even touch a single practice question, your success begins right here, in your head. A positive attitude isn't just some fluffy, nice thought. It is a foundational piece of your prep. You have to believe that you're going to succeed. Okay, let's talk about this, because seriously, this part is non-negotiable. We're calling it positive pampering, which is really just a fun way of saying you have got to take care of yourself. Your brain is going to perform way better when it's rested and fueled, not totally exhausted, right? So schedule some exercise, eat good food, and please do not cram the day before the exam. That day is for you. It's for relaxing. Period. So when you see a question that asks what you should do first, your mind needs to immediately jump to your prioritizing frameworks. And the first, most famous one is the ABCs. Unless you're in the middle of CPR, it is always airway, then breathing, then circulation. No exceptions. Next up in your toolkit is Maslow's hierarchy. This framework is a great reminder that those basic physiological needs always come first. You've got to take care of a patient's breathing or their nutrition before you can address their feelings of anxiety. It's such a critical tool for sorting through all those options.
Now, if the ABCs or Maslow's don't give you a clear-cut answer, you always fall back on the nursing process, APIE. And just remember, in almost every scenario you can imagine, the very first step is assessment. Before you jump in and act, look for the option that's about gathering more data.
You know, this might be one of the most powerful tips you'll ever get. Do not add information to the question. Don't invent these crazy what-if scenarios. You have to answer based only on the data you are given right there on the screen. Playing the what-if game is the #1 reason people talk themselves out of the right answer. Okay, with your strategy locked in, let's talk about the final battle, exam day itself. You've prepared your mind, you've got the knowledge, so now let's just handle the logistics so absolutely nothing can throw you off your game. So once you get that magical authorization to test email, your ATT, schedule your exam right away. Then, about a week before, do a full test run. Drive to the testing center, figure out the traffic, find the parking, see the building. It just removes a huge layer of stress. And remember what we said, the day before is for you. Relax. You've totally earned it. When you get there, just be prepared for a pretty secure check-in. You're going to need your ATT and your ID. They'll take your picture and even a palm vein scan. All of your stuff goes into a locker. Just knowing this whole process beforehand makes it feel routine, not stressful. So everyone, and I mean everyone, answers at least 75 questions. After that, the test can shut off at any point. And I know what you're thinking, but whether it stops at 76 or 125, you cannot panic. All it means is that the computer has collected enough data to be 95% sure about where you stand. That's it. So your only job, your only focus, is to answer this single question right in front of you. Take a deep breath, trust all that hard work you've put in. Look, you've done the work. You survived nursing school, and now you have the strategies to win this final battle. The only thing left to do is go in there and complete your quest. Go prove what you already know. You are a nurse. Good luck.